Hi, everybody. We are going to go ahead and get started. I want to welcome everybody to this 8th meeting of CSG's National Long-Term Care Workforce Network. I'm Sean Sloan. I'm a senior policy analyst at the Council of State Governments here at the national headquarters in Lexington, Kentucky. Here is our agenda for today. After a quick introduction and project recap from me, we will introduce you to our three presenters. Very excited to have all three of these folks joining us today to talk about long-term care workforce development initiatives in the states of Arizona, Indiana, and Tennessee. We have Peggy Welch, Chief Advocacy Officer at the Indiana Family and Social Services Administration, Bill Kennard, Administrator of the Office of Healthcare Workforce Development at the Arizona Healthcare Cost Containment System, the agency that administers that state's Medicaid program, and Annalee Cothran, Systems Transformation Director at TennCare, the Medicaid program in Tennessee. We encourage you to make extensive use of the Q&A and chat functions here in Zoom to converse with each other, to make connections, share resources, and submit questions and comments, which we will turn to in the last part of our meeting. Please stick around until the end, and I'll have a few announcements about our next meeting and other upcoming activities. So just a quick project recap from me, and apologies if you heard this spiel before, but last year with the support of the Commonwealth Fund, CSG put together an 8-state interbranch task force of state policymakers that convened multiple times over the course of the year and advised us as we put together the CSG Long-Term Care Policy Guide, which you will find on the CSG website. One of the focus areas that we had for that project was revitalizing the direct care workforce and supporting family caregivers. And in the policy guide, you'll find a number of strategies that states have deployed to address those issues in recent years. We are pleased to again be working on this particular project this year with the Commonwealth Fund to build on the work that we did last year. We've created this National Long-Term Care Workforce Network, an expanded version of last year's 8-state task force that now includes not only state policymakers, but a variety of subject matter experts, stakeholder groups, and other partners. We're developing a new website, a national online resource center that we hope will be ready to go very soon and become a clearinghouse for all the relevant work being done on long-term care workforce policy around the country. We hope our network members will share relevant legislation, policy reports, and other materials that we can post to the website and link to. With this project, we also have the opportunity to provide on-site technical assistance services for up to 5 states. If you believe policymakers in your state could benefit from a detailed briefing and action planning session on how they might move forward with policies to address long-term care workforce needs, please get in touch. As you think about legislative sessions next year, lots of people being in and around the Capitol, we would be happy to come for a visit, talk with folks about long-term care workforce policy, and perhaps bring a few friends with us. So without further ado, we want to dive into our main topic of this meeting, workforce development initiatives, and we are pleased to be joined by Peggy Welch. She is Chief Advocacy Officer at the Indiana Family and Social Services Administration. Peggy got in touch earlier this year and shared a presentation about some of the things happening in Indiana and also some of the questions that they've been asking about what they might look to do in the future. She is a former state legislator and a graduate of both the CSG Toll Fellows and CSG Midwest Build Leadership Development programs back in the day. Peggy, thanks so much for being with us.
Thank you. And you're going to turn me on there?
Yes,
Sean?
if I can do that, let's see. Or I can, Cody, can you put her on camera if you can, or I'm not sure I can.
It says I can't start the video, so.
Yeah.
Well, why don't I get started and y'all figure that out, because I would like to be on camera. And thank you so much for inviting Indiana to participate in this, Sean. And it's a real privilege to be here, especially with Annalee and Bill, who are true champions of workforce development for our direct service workers. I'm going to jump right in here. I'm going to talk really fast, folks. I have a bunch of slides. I'm just going to hit the highlights on them and then see if we have time for questions. And then I have provided at the very end my contact information so that we can visit if you want to call or email. As you are looking at the agenda, basically, I hope by the end of this quick presentation that you'll just know a little bit more about the multiple aspects of Indiana's initiative and efforts regarding direct service workforce development. So on the next page, just a quick overview of why Indiana started pursuing a reform of its long-term services and supports. So in late 2020, early 2021, there was this move to reform LTSS in the state of Indiana. Now, you see right there, it says drivers. One of the things that's not put is that Dr. Rusiniak, Dan Rusiniak, who is now our secretary of FSSA, before he was our chief medical officer, and when COVID started, he was deployed over to our Department of Health, and he was made the point person for having the response for our long-term care facilities. He came back to FSSA and was saying, oh my, we've got to make it easier and the first choice for people to be able to stay home. So that was definitely a driver, but we know that Hoosiers and all American citizens are aging, and that population is growing. We also know that we need to reform the system so that people can have a choice, and most people choose to want to stay at home. Also, we want to improve quality and manage the cost, because we know fee-for-service is much more expensive than managed care. A few of our objectives when this whole initiative started, people said, oh, so you just want to take everybody out of the nursing homes. No, but for when people are moving toward having to have assistance because of aging and or disability issues, they should have the choice to be able to go into a home and community-based setting. So for those new LTSS members, we are the program that we're really moving forward, we're calling it Indiana Pathways, but this particular part is specific for people who are 60 and older, and it's looking and using the aging part of the A&D waiver, just as an FYI. And we are paying for outcomes, not transactions. It's been a multi-year change in the culture and the mindset within here at FSSA, that we are not here to do transactions. We are to do make transformational decisions and working closely with our citizens. Looking at the recruit, train, support, and retain HCBS direct service workforce, I'm going to be talking about that more in just a minute. And then real excited we have had, since the first of 2021, over 700 meetings of stakeholders, bringing stakeholders together to talk about how should this be reformed in the design of the RFP to be able to bring on the managed care entities, and then all the meetings that we also have done within the direct service workforce planning. So very proud of that stakeholder engagement. Moving to the next one. So let's talk about our actual direct service workforce plan. So in July 21, Dr. Rusiniak came to me and he said, hey, Peggy, if we're going to make it the first and easiest choice for people to stay at home, we got to have a workforce. Would you take that on? And so I naively said, sure, I can do that. And it's been a challenge. It continues to be a challenge, but it's so exciting in the differences that we're going to be able to make in the state of Indiana for our direct service workforce. All of 22 was actively developing our plan. And when you see the direct service workforce plan, I want to make it very clear that the plan is about the workers. And we believe that if we can help the workers be successful, they're going to go to work, and then you're going to have success for your consumers and for your providers. As you look at our vision, data-driven, community-informed, statewide plan, one of the things we make very clear that the whole MLTSS reform birthed our direct service workforce plan, but it is much more than that, than just the pathways of aging. It's going to be for all waivers, and we are really looking at how do we translate what's being done for the aging waiver to be able to affect all the other waivers. So if you got any ideas about that, would appreciate it. You can see we have multiple partners. I'm going to be talking about the advisory board in just a minute. We've worked very closely with internal divisions, but also our Department of Health. We in the state of Indiana, we're separated. Also our Commission of Health, our Commission for Higher Ed, our Department of Workforce Development. Just real excited about all the partners that we have in developing this workforce plan and implementing it. And again, all kinds of stakeholders. Priorities. The two priorities you see there were what were really developed for the whole LTSS reform, but I appropriated them. And this is very important, a priority for our DSWs, that what we come alongside of them needs to be person centered for them. And that also we need to be able to be very aware of their needs and what they think is important to them. Next slide, please. So,
Peggy, by the way, Evelyn, your camera has been enabled now. If you want to come on camera.
Okay. Let me do that. Thank you. Well, it is not coming on, and I've got it open.
There you are.
There it goes. Okay, hi everybody. Okay, I'll keep moving. Could you go back? I think we skipped the one that says key results. There you go. Thank you so much. Just want to say we use as our way of managing our outcomes. We're using the objective key results. That's John Doerr, measure what matters. It's really important to Dr. Rusiniak, and that's how we're doing it. I'm gonna let you look at those 3 different key results that we're attacking, but I want you to notice the last bullet on each of those is coordinate and align with the 3 managed care entities. I'll address that toward the end, but that's very, very important. I want you to notice in the key result 2, training, support, retain, career lattice. People talk a lot about career ladders. We have heard from our direct service workforce advisory board members, stay in the job that they have, that they love, but please respect me, pay me more, recognize my experience and use it. So that's something that we're really focusing on. And then data, oh my gosh. If I asked this question at the HCBS conference, and the only person that raised her hand was Anna Lee for Tennessee. But the question is, who's really satisfied with their state-specific data regarding the direct service workers? That's really important to us, and always love feedback and assistance in thinking how we can best gather that data. If you'll go to the next one regarding work groups. So we have this big plan, and we have all these different ideas. And now around those strategies, we've pulled together work groups. Number 1 work group right now is regarding training. We are moving that way anyway, but in the 2023 legislative session, there was legislation that was passed into law that requires the development of a credential, training, and a registry. So we are actively moving toward that. We started at the end of June, bringing a lot of stakeholders together, meeting multiple times. And then just on October 6th, we had one more big meeting of really looking forward what should be the title. And just FYI, we heard from lots of people, the word professional needs to be in the title for these workers. What's the definition of who they are, especially the unregulated DSWs? And then what are the core competencies that everyone should have before they would step into a home and start providing care? And then the development of a registry. So we're really active with that work group. Wages and benefits. We are so pleased that our legislature in 2023 increased the rates for home and community-based providers. There's no requirement that it has to be passed through. So we'll see what really happens. And then, like most of you, we used our ARPA money and from the beginning to provide grants, stabilization, sustainability, encouragement grants for our HCBS providers, and with most of it being passed on to the workers. Promotion and planning, we are looking to so many states, Wisconsin, Kevin Copeland and others who have had really successful marketing programs. And so we're calling on our friends to learn from them about how we can best get the word out about who these workers are, why they should be valued, and then what they can do to be of assistance to families. And then data, again, trying to figure out what we need to do. Next slide. I want to talk about the advisory board. This was critical. Why did we decide we needed an advisory board? What we tend to do in companies, government, we say, we see a problem, let's fix it. We're going to come up with some solutions, and then we're going to go to the people who it affects and say, this is what we've done for you, and you're going to like it. And that's not the way to do this. We need to hear from the people who are actually doing the work. Want to give a huge shout out to Advancing States. They've come alongside of us to help us be successful in pulling this advisory group together. And then as we've worked through all of 2022 together and now 2023. I just heard a story recently that there was a state that tried to have an advisory board and it just wasn't successful. And we were thinking about why was it not successful for them? And if you're interested in having an advisory board, would love to talk to you about it. But it's real important, at least at the beginning, to have an outside group to come alongside, as we had Advancing States to help us, because it provides a little separation from government. Also, we provide compensation. Anytime we have a meeting, those that attend receive a gift card. Also, active communication. I'm doing a lot of emailing back and forth with them, and then keeping it to a manageable size. Because if it's too big, you think, oh, well, I don't have to show up. Nobody's going to miss me. It's important that it's a small workable group. We have about 17 that do that. And I'm really proud. I have to brag. Some of our folks are becoming rock stars. One of them was featured at the 2022 HCBS conference on a panel. Just recently at the National Association of Medicaid Directors, 2 of our DSWs were featured in a panel, and people just love them. And there are more and more invitations coming because folks want to hear from the folks that are actually doing the work. Next slide. So when I asked Sean, I said, hey, Sean, what do you want me to really focus on? And he said, hey, Peggy, those how might we questions that you used at the HCBS conference were really helpful. Up on my whiteboard right over here, I have dream audaciously, think divergently, and execute intentionally. And that thinking divergently is very, very important. So I just want to just hit very quickly on a few of the things that we're looking at. And things that we would love to have your input on. Also, we've really got to raise the public perception of these workers, mostly women, that they are essential. And they're not just essential when now you need help with your mother's toileting. They are essential all the time in what they do and what they provide and the supports and services they provide. They are valuable and they should be valued. Also, we need to make sure that they're integrated into the total care team. I had the privilege of working 18 years as an oncology and hospice nurse. And I always appreciated when I worked night shift, when a doc would come and ask me, how was the night? What are you seeing? What do you think is going on? That input, because I was with them for 12 hours, the same as with our DSWs, they need to be consulted and part of the team. We're really looking at some smaller work groups, and hopefully in 2023, we'll get this done. One is the benefits cliff, fiscal cliff. Very important. And I use the word address, but I really mean we need to attack this. And it's real exciting. Been talking to a lot of states. Really appreciate Erica Flesher with ACF for our federal region. She's been working with me. We've been talking with Federal Reserve. We've been talking with different organizations and different states about what can be done. And I'm just believing something is going to explode, and we're going to come up with a great way to address benefits cliffs to allow our workers to be able to receive pay increases, but not lose their benefits when they're not quite ready for that to happen. Also, we have untapped pools of potential DSWs. We've got persons with disabilities. We've got immigrants. We really need to do that. And retired teachers. I mean, I could tell you stories. So those are 2 things that we're really thinking about. Standardize. That's the word that we're using with our training programs as we're making definitions, as we're looking at roles and responsibilities. There are huge equity gaps within the different roles and the different waivers. We've got to close those equity gaps and reduce confusion for the workers, for the providers, and especially for the consumers. I love number 8 and would love feedback on this and for y'all to think about what are ways that we can educate our federal and state workforce leaders about a bunch of things. Specifically, I talk about local trainings because like the Department of Labor, if you're high demand, but you got to be high salary too to get any of the your local workforce training dollars. these are high in demand and essential workers. They just aren't being paid as much, but we need to have some of those workforce dollars, but we've got to help our federal leaders understand that. Also, looking at immigration, looking at cliff effects, looking at the ticket to work, the Medicaid buy-in program. There need to be some federal updates to those programs to make it easier. Also, looking at federal occupational classification codes so that we can have better understanding through data who's actually doing the work. Next page, just real fast. I'm excited working with our MCEs. One of them had come up with an idea of an employee assistance program to really come alongside and to help, I don't like using the word help, but to come alongside our DSWs in problem solving, connecting to resources, and just being a cheerleader for them. And so I'm excited about this possibility. And then again, you'll see a lot of data questions there. And then the next page, and almost done here. I would love to talk more about the value of having cohorts. We know from experience of our local community college system, Ivy Tech, that students who are single parents are more likely to graduate and get a degree if they are operating within a cohort to be encouraging to each other. So we want to look at that for the DSWs because sometimes they never see another DSW at all or anybody they can talk to. We're looking at value-based programs for the MCEs to be able to help providers, also for our workers. I want to just very close with our MCEs. We have 3 incredible MCEs. We've got Anthem, Humana, United Healthcare. With our workforce development administrators, we've all come to the understanding that we have to collaborate. We have to coordinate if we're going to be successful. There's plenty of work out there for them, but we've got to do it together. And I'm excited to see what we're going to be doing over this next year to be able to grow the direct service workforce within the state of Indiana. So thank you so much. If you go to the next slide, you'll see my contact information. Please don't hesitate to contact me with any questions, suggestions. Also, I would be glad to send you links to our DSW plan, the public facing one, then also the big scientific report with all the details in it. And then just the last page is just a timeline so you can see where we've been and where we plan on going. Thank you so much for this opportunity. And I am so excited now to hear from Bill and Anna Lee. Thank you, Sean.
Peggy, thank you so much. And we will reserve questions until the end of the hour, as we usually do. But if you have a question, you can submit it in the Q&A here on Zoom and at any time, and we will ask as many as time allows. And Peggy, feel free to take a peek in there and join the conversation if there's anything to respond to quickly or anything we should bring to the attention of the full group as we move along here.
I'll do that. Thank you, Sean.
Absolutely. Right now, I want to welcome Bill Kennard. He is the administrator of the Office of Healthcare Workforce Development at the Arizona Healthcare Cost Containment System. Those with long memories will know that Arizona was one of the members of the 8-state task force that we had last year. Then Medicaid Director Jamie Snyder and then Senator Tyler Pace were among our task force members. We heard a fair amount about how Arizona planned to spend its ARPA, FMAP, HCBS dollars to address workforce challenges from them. Bill is going to talk about various workforce initiatives, data initiatives, and the overall vision for Arizona's workforce development efforts. Bill, thank you for joining us.
Sean, thank you. And it's a pleasure to be talking to all of you at this forum. So everything that Peggy said, and I'm a Hoosier by birth, but it wasn't until I moved to Massachusetts that I learned to talk fast. So I don't know where she got that. But at any rate, I'd like to talk to you about really sort of 3 things. One, just sort of the organizational context and the approach to workforce development, some of the specific initiatives, as Sean has said, and then kind of our vision for the future. So Sean, if you would advance that slide one, please. So just quickly, the Arizona Healthcare Cost Containment System, or ACCESS as we prefer to be known, is the Medicaid agency. So a little bit of our kind of performance indicators up there. in the lower right-hand corner, payments are made to 12 contracted health plans that are responsible for the delivery of care to members. So we contract with 12 different managed care entities. And Sean, if you'd advance again one time, please. And just kind of the way that we organize this is kind of by our lines of business. So kind of Access Complete Care is kind of our integrated behavioral health and primary health care. We have a regional behavioral health kind of segment that specializes in adults and children with serious mental illness, and our Arizona long-term care system for the elderly and people with physical disabilities. Kind of another part of Altex is the system for people with developmental disabilities. And last but not least is what we call our DCS, Comprehensive Health Plan. And that plan is for children in the foster care system. We also support a fee-for-service program that's primarily for the 22 tribal nations that are located in Arizona. And today I'm going to, Sean, if you just hit it one more time, I'm going to talk a little bit about the direct care workers. And direct care workers will come from our long-term care workforce segments. And advance the slide, please, sir. So when we talk about direct care workers in Arizona, we're talking about a specific class or type of employee. It's an individual who provides services in an individual's home or in a place that accompanies that individual. They perform attendant care, companion care, and homemaker services. And so, kind of not surprising, help wanted is our biggest challenge. We need to probably get about 190,000 more direct care workers by 2028. Now, that isn't on top of the existing workforce, but that's just our projection, given the kind of our turnover and retention challenges, that essentially we will, by 2028, we will probably recycle through about 200,000 new individuals who will perform that job, unless we're able to do something dramatically about our retention rate. Career development, it was a big challenge with particularly with our DCWs, and that people perceive the job as really a dead end, that they don't have opportunities for advancement. Our DCW training, since about 12 years ago, we have a required training program, and it's kind of a competency-based thing. So an individual can test into the program, or they can take the test, or some combination of things. Right now, that training program is about 12 years old, and we're revising currently the competencies testing and curriculum to bring it up to date. And in the training space, about 61% of our DCWs in a PHI survey that the health plans did a few years ago cite the lack of post-hire in-service training as a reason for leaving. So it wasn't kind of an isolated variable; it was in combination with other things. But 61% basically say the lack that I don't feel confident and I don't feel competent in providing services, in particularly when things require a more higher level skill set or a different experience than what I've been trained in. And last but not least, in terms of some of our challenges with the DCW workforce, is supervision. And in that same PHI survey, we found that 32% actually couldn't describe their supervisor's role, and 6% said they didn't know who their supervisor was, which was a little bit frightening. So those were some of the things that we said, well, we've got to do something about that very quickly. And Sean, if you wouldn't mind just advancing through, just to kind of drill down a little bit. This probably doesn't surprise anyone in the audience here. The reasons for leaving that DCW workforce: higher pay, just personal issues, burnout, and then there were other issues as well that are kind of listed down there. And Sean, if you could go one more, please. And the reasons for staying: organizational culture, the supervisor, communication, wages, and then there's a variety of other reasons that often had to do with relationships with people on the job, and care for members and experience, and just kind of career ambitions as well. So variety of reasons for staying, which we think are important to really know, because that's what we can build upon. So if you could advance one time, please. So our mission, our approach to workforce development, and I'll just kind of go through kind of that circle. I'll talk a little bit about our mission quickly, our model, the workforce initiatives, our data initiatives, and then our vision for the future. And then we'll move on to Anna and Lee, and you'll really sort of find out something good here. So let me kind of start talking about a mission. Sean, if you advance the slide. So Access's mission is to reach across Arizona and provide comprehensive and quality health care to those in need. Workforce Development's mission, and when I say my colleagues and I at the health plans, our collective mission is to ensure that the provider workforce has that capacity, competency, and commitment needed to reach across Arizona and to provide that comprehensive quality health care to those in need. So we really see the workforce as really kind of it's at least for another 30 years or so, kind of theorists say, it's the most impactful and relevant tool that we have in healthcare to extend and enhance healthcare outcomes, as well as to control costs. So our healthcare workforce is, kind of priority number one. And please advance, sir. So we've kind of got a model, and it's kind of a combination of philosophical, and you can just kind of advance this until the end of the slide there. So, and I'll just kind of talk to it. So our philosophical model is based on kind of this, what we call the 5 C's, and there's actually 6, but a kind of workplace connectivity, the alignment of the workplace with external and internal resources and supports that it needs to actually acquire and keep the workforce capacity, the workers, having the qualifications. You have to develop that competency of that worker. You have to have a culture that supports that competency and capacity that people want to come to. And that's, you're constantly working that workplace connectivity. And last but not least, the worker commitment. You earn that. And, we get to worker commitment with a connected workplace that has sufficient capacity, that really pays attention to the competencies that people need and the culture in which they work in. And kind of underlying all of that is the idea of compensation. So we found that you can't really just buy it, and you can't not pay for it. But what we can do a lot of is kind of work those other 5 C's. Our policy is, Sean, if you would, that too, please, thank you. Is we have a policy called ACOM 407 that describes the workforce development requirements for the managed care organizations. So all of our managed care organizations are required to have a workforce development administrator and workforce development operation. And just organizationally, if you'd advance that one more time, sir. The workforce is integrated with networks, quality, et cetera. And I think one of the things that we're really particularly happy about is our workforce development administrators work in lines of business alliances and as a coalition. So, for example, on the long-term care, on the All-Tech side, the workforce development administrators from the different companies work together as a team around common workforce development challenges. And then as a state, we work together on kind of common statewide issues. So, we didn't want to have our health plans kind of say, well, gee whiz, we've got the secret sauce to get to the minimum. What we want to do is make sure is work together to get to the minimum, and then, have our health plans compete for maximum and higher levels. And last but not least, each of the alliances, as well as the workforce development administrators, as well as the health plans themselves, create an annual workforce development plan. If you could advance one more time, please. So our initiatives, our workforce initiatives, kind of they came down into really those 5 things that we're talking about. So incentives, the majority of our $1.5 billion went to payments and grants to providers. So about $1.2 billion went directly to our providers for incentive payments that they use for additional training, kind of those cultural capacity capabilities sorts of initiatives. A second initiative that we addressed, just because of it was so striking, not only amongst the DCW workforce, but also amongst the behavioral health and our foster care system workplaces, was just the whole idea of career development and career lattices. And our approach to that was to partner with a group called Pipeline AZ. They've had for a long time a career exploration and career development platform that the high schools and even middle schools have used. So we partnered with them to kind of create a platform specifically for the Arizona healthcare system. So an individual can come on to that site and be connected to all of the open jobs that are in Arizona and our healthcare. We've used a differential adjusted payment to kind of incentivize our providers to create a platform or presence rather on that platform. And essentially there you can do skills tests, you can find the career lattices. The Pipeline AZ is kind of working with our provider community to understand what are those lattices, so that I can move laterally if I want, or I can advance into different aspects of healthcare. On the education front, we partnered with the Arizona community colleges to do two things. One is to offer a scholarship program for healthcare scholarships for healthcare degrees and certificate programs across the state. So there are 18 community colleges across the state. They all offer, some differences: community health workers, some behavioral health techs, CNAs, LNAs, RNs, and even home health aid, which is also in their curriculum would qualify an individual as a DCW. So we're kind of really trying to attract new workers by offering to pay for their education at a community college, and with just a kind of an intention to work in one of our HCBS settings. We're also using our partnership with the community colleges to use their curriculum development and training expertise to help us strengthen some of our initial and ongoing in-service training programs in not only our long-term care, but our behavioral health areas as well. And if you could advance the slide one more time. I guess everybody but Tennessee is working on databases and workforce data. So us too. We did not, we got caught over the last 3 or 4 years really without data at all about our workforce. So we've contracted with Myers and Stoppers to really help us really think through what we call a workforce database and decision support system. So in addition to kind of collecting information about the workforce that we want to be able to slice and dice in many ways, we also want to be able to do some projective things like assess our capacity relative to demands for services, determine how workforce recruitment, selection, training is contributing to service quality, things like that, as well as the forecast changes in the Arizona's healthcare delivery system, and what that means maybe ahead of time, so we can begin to prepare our plans for changing the nature of our workforce, perhaps before the model kind of descends upon us. And another piece of that workforce database and decision support is an evaluation of workforce development initiatives, is how to create a model and a method really for determining the return on investment, or for actually making an initiative to develop various aspects of workforce development, or to really capture the lack of return on investment if we don't do some of those things. And if you could advance one more time, please, Sean. So our vision for the future is to really continue to grow our Arizona's workforce development team. So When we think about that, we've got a pretty good team between within the healthcare administrators of the health plans. We want to extend that out to our provider communities and those workforce development teams at the provider level. So our strategy for doing that is to create a professional development experience for workforce development professionals at the provider level and certainly at the health plan level. And we're doing that in partnership with the Association for Talent Development. We're going to be doing some facilitator training. We're putting a lot of effort, money into creating and upgrading our training. So we're going to upskill the trainers that are in the provider community, a talent management for those provider level HR professionals, workforce development, best practice briefings for the provider executives, what's working, what's not working in terms of some of the, new thoughts, what we might have been trained in many years ago, that as workforce development practice is different today. We have to think about it in a different way. And then obviously a specialized training for our managed care organization, workforce development professionals. We also want to continue to expand collaboration with Arizona's communities. We want to grow our high school-based direct care worker training. Right now in the career and technical education, about 24 schools offer DCW training. We want to create better regional relationships between our providers and local community college districts, and obviously establish some relationships with the community and the regional economic development and workforce authorities to kind of direct more individuals into healthcare careers and to become a data-driven workforce development operation. So that's kind of an Arizona in the 30,000 foot level. On behalf of the coalition, my colleagues, and Access, thank you very much for allowing me to address you today. So thank you.
Bill, thank you so much. Please get your questions ready for Bill, and you can add them in the chat or the Q&A here. Right now, I want to introduce Anna Lee Cothran. She is Systems Transformation Director at TennCare in Tennessee. She previously served as Legislative Liaison to the Tennessee Commission on Aging Disability. Those of you who were at the HCBS conference in Baltimore in August might have seen Anna present there. Anna, thank you so much for joining us as well.
Thanks, Sean. So nice to be here, and just please be on record. Everything I've learned about workforce, I've learned from Peggy and Bill. So hopefully I can add a little bit more information to this. I do work for the Division of TennCare, which serves as the state's Medicaid agency. And we have been working on workforce efforts prior to COVID, but obviously continue to work on through COVID and until today. This work is done in partnership with many organizations. Lots and lots of collaboration with our managed care organizations, research partners, our advocacy agencies, and then our other state departments. Next slide, please. So this is kind of our workforce development plan in a nutshell. The direct support workforce, everyone knows, is super critical, and lots of research has been done on what we can do to help support and address the workforce crisis that we are continuing to be in today. And to do that, we've kind of developed these central tenets to our comprehensive workforce development strategy that I'm going to kind of hit on some of the initiatives that we're doing for each of these. Next slide. So when it comes to supporting and implementing our provider agencies with recruitment and whatnot, the vacancy rate remains high in Tennessee. And to help support that, we need to attract new people to the workforce. To do this, we've done these things that are on the screen. We've created a public service announcement and targeted marketing flyers. You can see one on this slide. This is directed to attract those new people to the field. We're working with our provider agencies through technical assistance and getting feedback from them on how they're implementing these new tools and how we can measure their effectiveness with reducing vacancies. Are we attracting additional people to the field, and are they being hired? We've expanded some recruitment techniques. One example I wanted to highlight is the Leaders in Inclusive Services, the LINKS program. This was an initiative that was born from one of our managed care organizations and then adopted by the other two. And this program offers students real job experience, allows them to build their resume while they're in school, and can help students discover new passions and opportunities in the healthcare industry. And if you're participating in the LINKS program, the colleges and the universities that are participating are offering scholarships and offered favored university admission. I was a DSP in college. I got school credit, would have really appreciated a scholarship as well. So we really hope that this is a great opportunity to kind of have a new recruitment opportunity for students in Tennessee. Early turnover numbers still remain high for our direct support professionals. And to address this, we developed a realistic job preview. You might have these in your state as well, or maybe you use a different realistic job preview. This one is Tennessee specific. We filmed folks in Nashville and Memphis, Knoxville, and a couple different communities across the state. And using this realistic job preview, we hope that it shows newly hired individuals how this job is, what this job is, and they can understand what being a DSP really is, the positives and maybe some of the challenges. We continue to work with our provider organizations to implement this as well. A couple of our provider agencies have decided to make their own specific realistic job preview, which we encourage. So that's one way that we've gotten feedback and have kind of helped providers to be more specific in what their needs are. The final thing on this to help support new recruitment and selection tools is we have actively worked to align training practices and requirements for both our 1915C waiver and our 1115 waiver, so across all HCBS programs. I'm really trying to streamline that onboarding process with a major focus on reducing that administrative burden. Next slide. When we think about retention, these are a couple of the initiatives that we're actively implementing and evaluating. So we're really focused on competency-based training. We know that that's essential to retain and improve the workforce. We know that the workforce is highly competent and really just hoping to highlight that and support them. So to build capacity for these retention efforts, we partnered with the National Alliance for Direct Support Professionals, or NADSP, and they launched the eBadge Academy roughly two and a half years ago. This was successful in our sister state in New York, and I know a couple other states have been implementing this as well, Georgia and a couple others. But we're excited. July is when we launched this initiative, and the eBadge Academy offers direct support professionals and frontline supervisors the ability to earn a national certification. So to do this project, we are offering DSPs, frontline supervisors, and our HCBS providers payments upon meeting specific quality metrics that are related to completing these certifications. So heard loud and clear from those who are participating that everybody needs to be incentivized to do this, and so we're really working to help meet those needs. We have expanded our DSP apprenticeship that's offered in the state. It was only offered through one entity, and now it's offered through all of our community colleges and our technical colleges. You can still take it online, so it's a statewide opportunity, but that partnership has proven to be fruitful and allowed for those DSPs or frontline supervisors who would like to go that route to be trained and receive college credit for that. Then we too have promoted kind of a career path opportunity, not only within kind of the healthcare industry, but within multiple industries. I think we started with over 300 possible career paths and had to narrow that down to about 100. So lots and lots and lots of opportunities for career paths. Next slide. So I kind of alluded to this in the beginning. Our managed care organizations, which we have 3 in our state, have been instrumental in helping with workforce development. This is, while they are contractually required to focus on workforce development, they're very, very, very innovative and always thinking of different things to do. They also work in tandem with each other. I would say workforce is something that they can all come to the table on. While they are competitors, they've really worked well to support each other and to support this workforce. So this is just a few of the collaborative efforts that they've implemented. Next slide. So we've learned a lot over the last few years about the workforce in Tennessee. And through this continued collaboration, we know that we need to continue to survey and collect data and evaluate these initiatives that are going on. I'd like to see an immediate yay, this is working, but everybody knows that this takes years of time and effort to see. But this is really how we are continuing to survey and make sure that these efforts are moving the needle forward. Next slide. So this is the snapshot of last year's survey, the statewide overview. And I wanted to show you this just so you can kind of see what high level overview of the data that Tennessee's collecting. This is an ongoing partnership between the University of Minnesota, TennCare, our Department of Intellectual and Developmental Disabilities, and our MCOs. We're entering in year 6 of data collection. And the University of Minnesota develops the survey, they analyze and report the results, which is super helpful to our Medicaid agency. All of this data informs our policy decisions, our planning around wages, benefits, and ways to recruit and retain. All of the recommendations you saw today have come directly from this survey. So we like to throw around data-driven a lot, and I hope that this shows that we are really trying to be intentional with the data that we're doing. We look forward to continued efforts to evaluate our workforce development initiatives. There's a couple things that are coming out about the specific things that we talked about today. So more to come from Tennessee. And I thank you so much for letting me share today.
Thank you so much, and thanks to all of our 3 presenters this afternoon. We want to turn now to questions, and as always, you can type a question into Zoom, or you can raise your hand if you'd like, and we can call on you, but please wait to be unmuted. And I know that Peggy and Bill have been looking in the chat there, and perhaps sharing some resources and connecting with folks in there. Anything we need to address so far that you've seen, Peggy or Bill?
I appreciate Bill putting in some links that I think are very important for people to get more information. And there was a question about what we're really doing in Indiana, and are we going toward CTE? But right now, we're just trying to create a good, strong foundation and of who they are, and then the core competencies, and then we'll start building on that. But we are working with our Commission on Higher Ed, as I mentioned, and also we're working with workforce development, and so and through our community college system. So we have a lot coming, but hope that y'all all saw and just seeing what Arizona and Tennessee are doing. It's possible. And so we use them as our inspiration.
And Annalee, there's a question in there for you now. Could you elaborate on how you are expanding the DSP apprenticeship?
Yes, so we the apprenticeship started in Tennessee 2 years ago. we had developed a training program through a SIM grant, and I'm totally blanking on what SIM stands for right now, but it was a federal grant. And so the training was offered, but it wasn't incorporated. It was for the apprenticeship, but wasn't incorporated in the community colleges or the TCAT. So you could only take it if you were a direct support professional within a provider agency that was participating. And now that it's offered through the community colleges and the TCATs, this has really kind of opened the door to make it even bigger. With an apprenticeship, I've learned all of this, but with the Department of Labor, there's a couple things that come with an apprenticeship that you're able to really benefit from. Lots of WIOA dollars and some additional funding for maybe things that Medicaid dollars can't spend on. Like uniform reimbursement and whatnot. So that's we're building upon that, and really trying to help show that when an apprenticeship is embedded within a higher ed system, that you can have those stackable credits and move forward to perhaps an LPN degree if healthcare is where you want to stick with, or really trying to kind of build off what Bill's doing around the behavioral health field. You know, getting trained as a DSP, but maybe then you go for the RBT. So that's one thing. I mean, Kendi, I'm happy to talk more about the apprenticeship or send you information if that's something that you're interested in.
Great. Other questions, folks? One of the things I wanted to ask about was, and this is something that you were talking about, Peggy, and that certainly it sounds like they've been addressing in Tennessee as well. But it's this idea of raising the public perception of DSWs and kind of what the policy levers are for doing that. So what are some of those ideas for raising the public perception of those folks?
Obviously, a strong marketing plan, and both these other states have done that as well as others. But recognizing just because they're not high salary doesn't mean that they aren't important, and that those very people who are saying, "Oh no, it needs to be high pay," are not going to be thinking that when they might need some assistance themselves. They're going to find those people to be very essential. And so, how might federal dollars be used with training programs specifically? And as you mentioned, Annalie, about the WIOA money and other things, it's really pulling that together. And so, but it's an attitude that we have to. It's not going to change overnight. But part of it is, and I'm being kind of frank here, it's raising the perception of themselves, that they are valued and they are critical to success for people being able to stay in their homes. And so that's part of our responsibility too. And that sounds kind of squishy, but it's true. And so that's part of what we're looking at also when we say we want to come alongside.
And there's a question in the Q&A now. It says, is there a multi-state national conversation about investing in this under-invested professional direct care workforce? This largely female workforce has been devalued by the care system in terms of comparative compensation rates when rated next to custodial environmental services work. This person says, I believe we need to reckon with never going back to a largely unpaid family care workforce to a professional, trained, and compensated workforce that must make a livable wage as entry level, pathway to invest in a $25 an hour as a floor of minimum wage. Any thoughts on that perspective?
So there is a national, I know there's a national conversation not only with the Council of State Governments, but also with Advancing States. We learned at the HCBS conference that Advancing States wanted to kind of continue those discussions. And I mean, this isn't new, but states learning from other states is really the best way to go, and a louder voice when it comes to advocating for the higher wage. I think we've seen that's been the best so far. In our state, I am really grateful that we've had 3 consecutive pay raises in the last in our last 3 legislative sessions, which is unprecedented. So I'm gonna choose Peggy's squishy idea and think that we can only go up from here. But in the meantime, you know, thinking about all the other things that we can do to help support this workforce in addition to wages, I think it's where I continue to come back to.
But family is always going to want to be engaged, and it's figuring out how to come alongside of those family caregivers, and bring folks from the outside when they need that additional assistance or respite. And also really focusing on self-direction is huge. We hear a lot from our consumers that they want to be able to self-direct who they hire and do their own training. Those are questions that we're continually dealing with. But families are going to want to continue to be engaged, but families should be compensated also in different ways. They are as structured family caregiving, but is it enough for them to be able to live on that, to be able to support their family as well as the person that is needing the support and services? Does that make sense, Anna, Lee, and Bill?
Absolutely. Well, thank you so much. And we are just about out of time for this afternoon. I want to once again thank our panelists for joining us. A couple of quick notes before we go. I am pleased to announce that our next network meeting is scheduled for Friday, November 17th at 3 p.m. Eastern Standard Time. We will have gone off daylight savings time by then, some of us. Registration is now open at the link on your screen. For that meeting, we are going to highlight long-term care workforce issues and initiatives in California, Florida, and Minnesota from the perspective of state affiliate organizations of the American Healthcare Association and National Center for Assisted Living. Let's see. So also, if you joined us for our meeting last month, you may have heard Betsy White invoke the name of one of our guests for next time, Claire Enright of the California Association of Health Facilities. Claire will join us along with Kristen Knapp of the Florida Healthcare Association and Nicole Matson from Care Providers of Minnesota. And Dana Ritchie and LaShawn Bethea from AHCA and NCAL will join the conversation as well. I know that a lot of folks from various AHCA, NCAL state affiliates have bolstered our network membership and joined us for these meetings in recent months. So we are excited to highlight the workforce interests of these facilities and organizations in these states in a more formal sense next month. We are also gearing up for the CSG National Conference, which will take place December 6th to the 9th in Raleigh, North Carolina. We are planning to highlight the work of the National Long-Term Care Workforce Network during a session on December 7th. We'll have a few folks you may recognize from past meetings of the network joining us for that session, including April Young from Advancing States and Alice Bonner, Betsy White, and Kezia Scales from the Moving Forward Coalition. Plenty of other great sessions to explore as well in Raleigh, so we hope a few of you can join us. If you or a colleague is currently not on our mailing list but would like to be, please reach out. As always, we welcome your suggestions for future meetings. And yes, we will share the slides from our speakers today, as well as a link to a recording of today's meeting to everyone on the mailing list. So be on the lookout for those. As I mentioned, we are working to develop our National Online Resource Center. We're hoping that will be ready to launch very soon. Please send us your relevant bills, reports, resources, articles, and initiatives so we can populate the website with details about what's going on in your states regarding the long-term care workforce. If you would like to request an on-site technical assistance action planning event, or perhaps just a visit time to your legislative session next year, please get in touch. We can also provide more information on who is eligible to request those services and what those site visit events might look like. Thanks so much again for joining us today and participating in the discussion. We hope to see everybody at our next network meeting or sometime down the road. So long from Lexington.
Thank you. Thank you so much, Sean.
Thanks, Peggy.
That was fun.
Awesome. Thanks again.
And no, it was good, and we appreciate it. So
Absolutely.
look forward to that. And I'll be forwarding that on to some of our folks, especially when Anna Lee presents. It's just astounding. And I am courting and have Patty Killingsworth whispering in my ear, though, also, and I appreciate that. She's incredible. Hey, thank you so much. See you later.
Thanks
Bye.
a lot. See you. Bye.